Good evening. You are tuning in to AWANI Tonight with me, Cynthia Ng. A year of intense hardship on the poor. We deep dive into Unicef's latest report on families on the edge. And should COVID-19 screening costs be reduced? That's coming up. The impacts of COVID-19 are felt by all Malaysians, but more so for the urban poor in Kuala Lumpur. In a survey by Unicef and UNFPA covering over 500 households between October to December last year, many low-income urban families were close to breaking point.
The Families on the Edge report found that recovery among households is uneven, as 46% of households have not yet recovered to pre-crisis level. Unemployment among heads of household has doubled from 7% in September to 15% in December last year. Despite government assistance, poverty rate among these families remains high at 42%, especially among women and persons with disabilities. More than half of these households were also unable to purchase enough food and unable to pay bills on time. Although government assistance helped, the coverage is quite poor, with almost 9 in 10 claiming they did not receive any self-employment related assistance. Social safety nets for the self-employed also need to be expanded, as only 1 in 20 self-employed are registered with either EPF or SOCSO. The families are more pessimistic about the future, with only 10% expecting their financial status to be better, and mental health remains a major concern, as more head of households are stressed due to the inability to provide enough food for the family and not having enough money to provide proper education for their children.
Female-headed households and households with people with disabilities are most impacted by COVID-19 based on the report. But with the end of the pandemic nowhere in sight, what would be the long-term impact if the situation worsens?
So low-income families in Malaysia are now approaching almost a year of intense hardship and psychosocial pressure. And I think that the impacts on children in particular are likely to be felt for years to come. So in terms of nutrition, educational attainment, mental health, behavioural effects, these are going to be very, very substantial. And so, a cross-sectoral effort is needed to anticipate and respond to many of those issues. Over the next few months, the MCO is extended, and then we'll be moving into a CMCO. And many of the most vulnerable families, and I mentioned female-headed households, households affected by disability, households reliant on informal employment, they are going to struggle during that period without support. And that is why the extension and strengthening of social welfare support is critical for that group. And it's why, as children go back into schools, measures are going to be needed within the school system to address many of the needs that these children are going to have, so that we don't have long-term scarring on children's life chances and future productivity.
Evidences suggest that as the situation continues to worsen, a lot more needs to be done to prevent the vulnerable from falling through the cracks.
Is that the Families on the Edge study showed that community support, as well as government support, has been critical for many low-income families. And I think Malaysians should be very proud of that. I think beyond that, the most important thing we all need to do is advocate in our families, in our communities, in our workplaces for a new deal for Malaysian families, built on principles of inclusion and dignity, and recognising that healthy, well-educated children are not only in the interests of parents and children themselves, but they're in the interests of society as a whole. So public policies for children and families need to reflect that principle. What we can't do is cross our fingers and hope that all will be well, because evidence suggests that it won't be. So we need a new deal for families in Malaysia going forward.
The Consumers Association of Penang has urged the government to control the price of COVID-19 screening tests at private clinics so testing becomes more accessible to all. Would reducing the price of COVID-19 tests bolster our pandemic response? And are private healthcare practitioners receptive to this idea? We spoke to Datuk Dr. Kuljit Singh, President of Association of Private Hospitals Malaysia, and Professor Datuk Dr. M. Subramaniam, President of the Malaysian Medical Association, for their take on the matter.
We must also understand the whole testing has got a process and there is a cost to it. We want to have it feasible so that it is also sustainable by the private doctors and private hospitals to keep doing the tests. We definitely are looking at making the tests affordable to the public so that more can do the tests without any issue. To some extent, yes, there would be a better management of the pandemic if more tests is done. Perhaps it is probably a suggestion that if the government can help out in subsidizing some of these tests so that the cost can be shared.
The general practitioners or the private sector, it must have to include all these costs. Can't just take, they're only $100, they're testing $200. But you must understand, if you open a clinic, they have to run the air conditioning, they've got to look at the electricity, they have to pay the rental for the place. You might say, this rental is already been agreed on a monthly basis, but the monthly basis rental is divided over a period of time. To cover that, there must be income coming. So this is not say they are making income cover the cost.
The Health Ministry had previously said it was in the midst of studying measures to control the price of RT-PCR screening tests at private hospitals and clinics that can be implemented through the emergency ordinance. How can we make COVID-19 testings affordable for the public and at the same time sustainable for private healthcare practitioners? Dr. Kuljit weighs in.
I think it's fair to sometimes have some sort of control for price of the test. But before a price test is decided, it is important that the government stakeholders and the regulators have discussion with the private sector so that the price capping that is decided, it is acceptable and also, as I said, sustainable to run the tests. We do not want a situation when the test is too cheap that many of the private providers will stop doing the test because it is not sustainable for their business.
We'll take a short break. Stay with us. Welcome back. The Health Ministry reported 3,100 COVID-19 cases today with 24 deaths, the highest fatality in a single day since the pandemic started. Malaysia's COVID-19 death toll is now at 896. Selangor still leads with the highest number of daily COVID-19 cases with 1,196 new cases, followed by Johor, Malacca, Kuala Lumpur and Penang. 30 new clusters were reported, 11 involving workplaces. Electoral Reform Group Berita 2.0 has proposed setting up 3 different commissions to oversee election management in the country. It suggested that the functions of the Election Commission should be split into different entities, including the formation of an Electoral Enforcement Commission and an Electoral Borders Commission.
Berita said the Election Commission would still be responsible for conducting elections, including managing voter registration and maintenance of the electoral roll. The Electoral Enforcement Commission would be in charge of monitoring and enforcing electoral laws, including regulating the political parties, while Electoral Boundaries Commission should be an ad hoc entity to review and fix the limits of electoral boundaries. Berita said the existing laws and structure of Election Commission had made it susceptible to abuse and manipulation.
The U.S. Department of Justice has issued an arrest warrant to a law firm in London in an effort to recover $330 million allegedly misappropriated from 1MDB.
According to The Guardian, the UK's National Crime Agency served the warrant to Clyde & Co on behalf of the DOJ, targeting the funds held in the National Westminster Bank. Prosecutors allege the money is about all that is left of the proceeds of the first phase of the 1MDB fraud, which allegedly misappropriated $1 billion of 1MDB funds. According to prosecutors, $700 million was used for the personal gratification of 1MDB conspirators, while $300 million was diverted to a joint venture between 1MDB and PetroSaudi. PetroSaudi, meanwhile, maintains the money was generated through legitimate business.
On to international news. Tens of thousands joined anti-coup protests across Myanmar as workers went on a nationwide strike. The third straight day of protests saw health workers, teachers and monks take to the streets demanding the release of Aung San Suu Kyi and the return of democracy. Confrontations between the authorities and demonstrators boiled over today as police fired water cannon at peaceful protesters in the capital, Naypyidaw. The protests have been especially unusual as a great part of the city's population are civil servants and their families. Over the weekend, thousands of people took to the streets in the biggest protest since the military coup last Monday. The junta detained Suu Kyi and dozens of members of the National League for Democracy, claiming fraud in last November's elections, which the NLD won in a landslide. Eighteen people were confirmed dead and at least 200 others were still missing after a chunk of glacier broke off and unleashed a devastating flood in India. Video from the northern state of Uttarakhand showed muddy grey floodwaters tumbling through a valley and surging into a dam before breaking it into pieces. The flood also destroyed bridges, roads and 2 hydroelectric power plants. Rescue workers are struggling to reach trapped victims in tunnels cut off by the floods, mud and rocks. Most of the missing were from the 2 power plants. Will the military coup by the Myanmar general responsible for genocidal policies in Rakhine State lead to another Rohingya refugee crisis? That's coming up on Consider This. That is all we have for you tonight on AWANI Tonight. Get the latest news updates and info on COVID-19 and the vaccines from astroawani.com and Astro AWANI app. I'm Cynthia Ng. We'll see you tomorrow.